In this video, we will be discussing home tube feeding guidelines. Every home-based primary care patient will receive a pack of information on their tube feeding. It will discuss what is tube feeding, how does tube feeding work, if they are on an NG or regular G tube feeding. It will cover how does tube feeding work, and it will also cover what kind of tube feeding they are receiving. Also, if it will be continuous, intermittent, or bolus. It will also cover the problems they may have, such as diarrhea, constipation, or nausea. It will also cover their water flushes and what medications they need to be taking, which they will have to contact either their pharmacist or their primary care provider for that information. And also it will inform them what to do if they are having abdominal discomfort or cramps, and if they missed a feeding. As you can see with this tube feeding, this is a single port with a side port to it. This will be where their tube feedings would go into. You may also encounter a port with 3 heads. These are usually used with the kangaroo pops. Very rarely will you see these for bolus feedings. So if you were to be at the patient's house and they're asking you to help with the feeding, always first do your patient identifiers and check your orders. And also do your hand hygiene. So we're going to apply our gloves after we've done our hygiene. And usually they will already have a syringe for their tube feed, but in case they don't, this is what the new one looks like. You'll just take this out. Some may be more cc's than this one. With every tube feeding, you'll want to flush with water before and after, per the orders of the provider. So just open this in, and we are going to do this by gravity today. Make sure the clamp is undone. And we're just going to pour a little water in. And let it go down by gravity. And everything went smoothly. So we'll clamp this off for a moment. And then we were going to do their actual feeding. And just for educational purposes, we are just using water. And you can unclamp that and let it go. Clamp. And then you will finish with water again. Clamp. When you're doing the feedings, make sure the patient is always at least at a 30-degree angle. You don't want to give this to them while they're lying flat on their back. And to stay at that 30-degree angle at least for about 30 minutes to an hour after the feeding. Hi, I'm Heather with Hbpc Primary Care Ravenna Team, and in this section of the video, we're going to be going over the use for the kangaroo pump so you can educate our patients in the home. Let's get started. Usually what they're going to have is a dual bag system, and always make sure that you've got the right product in the right bag. This one is for their actual feed, and the blue for water is for their distilled water. What you'll need to do is verify your patient identifiers, their name, their last four of their social security number, and their date of birth. You're going to want to verify their orders. How much flush are they getting, and how much feed are they getting? And some patients may be on medications as well that's going to be going through their tube feeding. So you need to verify with the provider and or pharmacist what medications can and cannot be crushed. If they are on medications that cannot be crushed, we need to see if that can be switched over to a different medication or the same medication in a different form so it can't go through their tube feeding. So what you want to do is turn on the pump. And everything has been cleared out at this point. One thing you always want to do, you want to make sure that you prime your lungs. You don't want any air going into their stomach. All right, once you hang up the bags and you've got your distilled water and your feed in them, then that's when you're going to want to loop it through the kangaroo system. As you can see, the two bags come to one. And there's a notch right here to catch on. So what you're going to want to do is place it in the pump like so. And this is going to catch right here. This tubing right here is very flexible, so you're kind of pull it a little bit, bring it through, stretch it up so that this notch right here will catch as well. And close the door. Turn on your pump. Do not prime the pump while attached to the patient. There'll be two options here. You'll have hold to prime the flush. And just keep it pressed down. And you have the option to hold to prime the feed. You want to make sure all the air is out of the tubing. And hit done. Now after checking your order, we're going to adjust the feed rate. And the option is right here, adjust feed. You've got your feed rate. And this is going to be how many milliliters per hour the patient will be receiving. The first number right here will be in your hundredths. The second number is your tens. And the third one is your ones. And hit enter. Then you want to do your volume to be infused. If they've got 1,000 in here, what I usually do is I just go to about 980. That way we can make sure we don't have any problems with it. And hit enter. And then you can hit run. And if you need to, you can hit flush now. Enter how much you want. After you've got everything set, you need to go back to the main screen, and this is where you're going to hit adjust flush again. And this time it's going to give you the option of flush interval. So once you have determined your flush volume, and we'll put that in, hit enter. You're going to want to go back in and also adjust your flush interval. And this is going to be however many hours they're going to be getting their flushes. And then hit enter. After you have programmed your pump, you're going to want to attach it to your veteran. And you always want to wipe off this area as well with alcohol. Make sure your clamp's open. This section right here, we're going to be talking about medication administration through the PEG tube. So what you'll want to do, if they're on a pump, you're going to want to put it on hold. Clamp their tube. Attach the feeding. And like we had talked about previously, check your orders. They probably won't have this type of pill crusher at their home. This is usually for hospital use, but we can get our veterans pill crushers. And you won't need a lot of cc's of water. Maybe about 2 ounces can work, depending on how many medications you're given. Make sure everything's mixed properly. And after you have administered your medication, you'll want to do a flush. And this can either be done by the syringe or through the pump. Once again, clean. And clamp. And you just need to do it enough to make sure all the medication is out of the tubing.